Hi, my name's Catherine and I'm an international board certified lactation consultant, and I've just come to talk to you a little bit about antenatal hand expressing of colostrum. So, who might want to do some antenatal hand expressing? Well, it's generally suggested for mums with gestational diabetes because their babies can be born needing a little bit of extra milk if they have some low blood sugar. They're more likely to have low blood sugar. But it can also be a good idea for maybe babies that are born a little bit early, maybe sort of 37, 38 weeks, or multiple birth for the same reason. When they're born at this gestation, they can be a little bit sleepy and sometimes a little bit harder to feed in the early days. So it can be good to be able to give them a little bit of colostrum straight away if necessary. It can also be a really good idea if your baby has got a physiological problem, such like a cleft palate or cleft lip, and you know that they may struggle a little bit more to breastfeed, or that you may need to start with expressing as well. And also, it can be a really good idea if you've had a previously difficult breastfeeding journey. So maybe your baby had a tongue tie, or baby wouldn't latch to start with, and you just it can be a good insurance policy in case that sort of thing happens again with your second or third baby. So why might we want to do hand expressing? And it's really it's to have a little insurance policy, and it means you can take some colostrum into hospital with you, and just means that you have some there ready if they need a bit of extra straight after birth. And that's the main reason. But it can also be really good practice just to actually get to know your breasts and how they work and how hand expressing works before the baby arrives. So yeah, and you can just, even if you just have a go in the shower, sometimes it can be a really good idea just to kind of get used to what you have to do in order to hand express. So when is it safe to begin hand expressing? So there was a study called the DAME study, which was a study to do with mums with gestational diabetes and whether antenatal hand expressing helped with establishing breastfeeding. And they found that it was safe from around 36 to 37 weeks pregnancy. And so this is what most hospitals, most healthcare practitioners will suggest that you do, so from around 36, 37 weeks pregnant. And so how do you do it? So it's the same as hand expressing after the baby's born, actually. So if you've ever done any hand expressing before with a previous baby, it's the same concept. But let me just talk you through it and how it works. So we do lots and lots of massage all the way around the breast. And what we're doing is trying to get the oxytocin flowing and trying to move some of the colostrum down into the breast a little bit more, so it's a bit easier to get out. We also massage the nipple as well. Okay, once you've done that for a couple of minutes, what we've got to do is find out where to squeeze. Okay, so if we just feel up the breast, you should be able to feel a kind of change of texture inside, and that's where all the ducts are kind of gathering. It's quite often around the edge of the areola, though some mums have bigger areolas and some have smaller, so it's not the best guide, but often about an inch or so behind the nipple, back from the nipple. Okay, and what we're going to do is we're going to make a C shape around the breast at this point, and this is where we're going to squeeze. And we basically squeeze back into the breast, into the chest, squeeze your fingers and thumbs together and hold it for a second. Okay, and then we will do this again, back into the chest, squeeze your finger and thumb together and hold it for a second. And you may start getting a little drop on the end of your nipple. It might look quite see-through, or it might look quite sort of dark yellow colour. And what you can do is take your syringe and literally it's just suck the drop straight off the nipple like that. And do it again and again, and you may get another drop. Okay, you can suck it like that. All right, so you can keep doing that until you've had a good go for sort of 10-15 minutes or so. Some mums will actually get quite a larger volume, and so what you can do if that is the case is you can actually express into a little container of some sort, so maybe a feeding cup or an egg cup or maybe a shot glass or something like that, and that's fine. And then you can suck the colostrum up into your syringe after you've collected it. Just make sure that you've sterilised the container with some boiling water before you start. So once your colostrum's in your syringe, some of them have caps and you can put a cap on the end. Some of them don't. If it doesn't have a cap, just pull your syringe further through like that so the colostrum moves down inside, so it's not right on the end. And then what we would do is we would label it, and you put your name, the date and your hospital number on. The reason for this is that I've heard so many stories of hospitals losing people's colostrum that we need to make sure that we label everything so that it's really clear who it's from and what the date was that it was expressed. And then you can either store in the fridge if you're going to go into a hospital the next day or two, or most of the time we suggest you put it in the freezer so that you can collect it slightly in advance. And you would store it in a Ziploc bag or in something with a lidded container, just to make sure that we didn't get any drips from any other things in the freezer or fridge that would contaminate the syringes. And when you get to hospital, so you would take it out of the freezer, maybe put it in a cool bag and take it to hospital with you. Make sure you tell everybody that you've got it, okay? Because quite often I've heard stories of hospitals losing it or forgetting to use it or such like. So you need just to make sure that they all know. All right, so tell everyone that you've got it. Hospital will take it off you and put it in their fridge. That's why we needed to make sure that it's labelled properly. So how much might you get? So some mums really barely get anything at all. Some mums really struggle to get any at all, and actually that doesn't really matter because practice is all good. You know what I mean? So even if you don't end up taking any with you, you'll probably find that hand expressing is easier after birth because you've had a good go and you've worked on the technique, etc. Most mums only get a tiny weeny little bit. They'll maybe get a few drops each time they do it. We usually suggest to do to try sort of 2 or 3 times a day for about 10-15 minutes, something like that. Make sure your hand doesn't get, obviously you can try both breasts as well. Your hand can get quite tired, so you can swap between sides. You can add to, if you're only getting tiny amounts, you could add to it. So if you've done one expression earlier in the day and you're doing another one later, you could add to it, put it in the fridge in between, and then you can freeze the whole thing at the end of the day. But as I said, some mums will get quite a large volume as well, so that's why sometimes it's better to do it into a cup and not straight into the syringe. So everything is normal. The other thing to remember that actually if your baby's feeding well, you don't actually need to use this, okay? So we would much prefer that baby's feeding well from the breast. And if baby is feeding well from the breast, you don't actually need to use your colostrum, okay? So you can leave it and not use it. Because we'd much prefer baby to be able to take it directly if possible. So that's my little guide to antenatal hand expressing. I hope that was helpful.